Hello everyone. In this video, I'll take you to all the way back to general pathology, to a topic that they like to bring as an exam question in preclinical and clinical years of med school and even in pathology residency, which is patterns of necrosis. We have mainly six patterns of necrosis, starting with coagulative necrosis, which is mainly due to ischemia. It's a form of necrosis in which the architecture of dead tissue is preserved for at least a couple of days. And it results usually in intensely eosinophilic cells with indistinct or reddish or no nuclei. Like you can see here, for example, in this area, there are all dead eosinophilic cells with no nuclei compared to the preserved part near to it. And it causes here a wedge-shaped kidney infarct in this example. Moving to the second form of necrosis, which is liquefactive necrosis, which is characterized by digestion of the dead cells, resulting in transformation of the tissue into the viscous liquid. This is seen in focal, bacterial, or occasionally in fungal infections. The necrotic material is frequently creamy yellow in liquefactive necrosis due to the presence of leukocytes and is called pus. And usually, hypoxic death of cells within the central nervous system (CNS) often manifests as liquefactive necrosis. Moving to the third pattern, which is gangrenous necrosis, which is not a specific pattern of cell death, it's more of a clinical term. It's usually applied to a limb, and generally its lower limbs, that has lost its blood supply and has undergone necrosis. So it's typically a form of coagulative necrosis. It usually involving multiple tissue planes, and when bacterial infection is superimposed, there is more liquefactive necrosis because of the actions of degenerative enzymes in the bacteria and giving rise to wet gangrene. Then we have caseous necrosis, which is encountered most often in foci of TB infection. The term caseous is actually derived from the friable white appearance of the necrosis, like what you can see right here, what you can see also right here. So microscopically, these necrotic areas appear to be structureless collection of fragmented or lysed cells and amorphous granular debris enclosed within a distinctive inflammatory borders, which is called granuloma. The fifth pattern is fat necrosis, which refers to focal areas of fat destruction, typically resulting in release of activated pancreatic lipases into the substance of the pancreas. So this occurs in the abdominal emergency known as acute pancreatitis. In this disorder, pancreatic enzymes leak out of the damaged acinar cells and liquefy, causing this chalky white areas that you can see over the pancreas, which is also known as fat saponification. Histologically, the necrotic areas usually contain a shadowy outlines of the necrotic fat and basophilic calcium deposits. Finally, we have the fibrinoid necrosis, which is a special form of vascular damage, usually seen in some immune reactions of blood vessels. Recently, I uploaded a video talking about the fibrinoid necrosis seen in leukocytoclastic vasculitis. I'll put the video on the link on the description. It typically occurs when complexes of antigens and antibodies are deposited in the walls of arteries. So the wall of arteries here shows this pink circumferential bright area of necrosis and inflammation.